Edutainment Studios welcomes you to Alzheimer's disease. This module is part 3 of a 4-part series on Alzheimer's and is aimed at helping you have a better understanding of the disease. Alzheimer's is a disease of the brain and is the most common form of dementia. This disease affects memory, thinking, and behavior that is not typical of normal aging. It will progressively get worse over time. In this course, the objective is to help you apply some tips if you are a caregiver to someone with Alzheimer's, and describe how to interact and communicate with them. If you are a caregiver to someone with Alzheimer's, you are most likely a family member, which can make your life very stressful. You need to remember to stay in touch with all of the doctors and mental health care providers involved in their care. As the disease progresses, these physicians will be able to provide helpful information about resources you can utilize and give guidance on ways to manage their care and plan for the future. While caring for a loved one, it is normal to feel like there has been a significant loss, with periods of depression and despair. It is also normal to be in denial that your loved one is ill, which can later turn into feelings of guilt, anger, and frustration. You may also experience physical symptoms such as headaches, upset stomach, and muscle tension, along with changes in your appetite and sleep routines. Everyone handles grief in their own way. It is important to be open with their doctor, as well as your own doctor and any other support staff you may have. As a caregiver, you can develop feelings and beliefs that you should do or should have done more to help your loved one. You need to understand that the illness is not something that you can control. Let's talk about some things that can help you with the coping process. Recognize that feeling guilty is a normal part of the process, and yet there is nothing to be guilty about. Share your feelings and talk with someone about them, support groups or family and friends. Learn to recognize, accept, and celebrate the good things that happen. Make some time for yourself to exercise, meditate, and do something you enjoy. Ensure that you're getting enough rest and try to find humor, even in difficult moments. If you find that the grief is too overwhelming, seek help from your doctor, counselor, or therapist. The important principle here is that you have to remember that if you are the caregiver and something happens to you due to self-neglect, then where will that leave your loved one? So aside from providing a safe and nurturing environment for them, taking care of your own needs as well is extremely important. As Alzheimer's disease progresses, you may need to change the way that you communicate with them. It is helpful to make eye contact before touching or speaking to them. Use short, simple sentences in a calm voice. Directions should be given one step at a time using short statements. Use words that would be familiar to them and give them time to understand and respond. Do not offer too many choices. Most importantly, speak to them as an adult and avoid making statements that call attention to their problems or the things they can't do. Keep focus on the positives in their life. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for part 3 of this 4-part series on Alzheimer's disease, and come back for part 4.